Hi, I'm Dr. Katie Lee. I am the founder of the Collective Health Society, and I focus a lot of my time treating patients on helping them fight periodontal disease. Periodontal disease or gum disease is one of the top 10 most common diseases in the entire world, and its incidence is actually increasing. We know that gum disease is tied to over 57 different systemic diseases, so treating it is really important. What I found over the length of my career is that treating it is actually quite difficult because the mouth is connected to the rest of the body. It is difficult to get results, especially if you're only looking at the bleeding gums and not treating the patient as a whole. So over time, I've really developed an approach where we take the patient's whole health into consideration, but then we also test the oral microbiome to figure out what bacteria are in the mouth and how to best treat them. So we'll bring in adjunctive therapies such as ozone and lasers to help eradicate bad bacteria in the mouth to help our patients get results. The reason it's so important to treat gum disease with an overall approach and a systemic approach versus just looking at the gums is because it's really taking into account the patient's immune system. So when patients have gum disease or gum inflammation, it's because they have bad bacteria in their mouth and they have a systemic inflammatory reaction going on. So unless you're treating systemic inflammation and taking into account comorbidities that the patient has, you're not going to be able to get results. So we treat both bacteria and we look at the patient's overall immune system and their systemic diseases. That way we can help mitigate inflammation and lower the bacterial load in the mouth, and that's how we get results. So gum disease is actually connected to over 57 different systemic diseases, and a lot of people don't know that. Some major connections that we see is that the bacteria in the mouth are directly implicated in heart attacks and strokes. So 50% of all heart attacks and strokes are caused by oral bacteria. We also know that of the people who died from the heart attacks and strokes, they analyzed the blood clot, and 70% of that clot makeup was oral bacteria. So gum disease bacteria cause heart attacks and strokes and make them more deadly. We also know that oral bacteria directly cross the blood-brain barrier and are the number 2 cause of Alzheimer's and dementia. We know that oral bacteria directly impact female and male infertility. In fact, infection by Fusobacterium nucleatum, which is an oral bacteria, increases infertility risk by 3 times. We know that 64% of patients who suffer from endometriosis have oral FN in their lesions. And then oral bacteria are linked to certain types of cancers, such as colon cancers and pancreatic cancer. So at our office, we take a 3-pronged approach to our gum health. So the first thing that we do is we want to test the oral microbiome to figure out what is causing the gum infection that's present, and if we want to know if that bacteria is affecting the patient systemically. Once we know what's present, we will go in and we will use adjunctive therapies, and a few of my favorites are ozone therapy and laser therapy to help treat the bacteria that are not responsive to cleaning alone. In fact, half of the bad pathogens in the mouth that cause gum disease do not respond to cleaning. So if you're only getting your teeth scraped when you go to see the dentist, it's not doing anything for half the bad bacteria. And then the third prong of our approach, which is really important, is that we integrate our functional medicine provider. They're responsible for doing cellular health and gut testing for our patients, because the mouth is the opening to the digestive system. So you cannot have a healthy mouth without a healthy gut, and vice versa. So by doing our oral microbiome testing, by using adjunctive therapies such as ozone and laser, and by bringing in our functional medicine provider, we are able to help our patients halt the periodontal disease issue and get healthy results. So we support patients who are anxious in our office by a multitude of ways. One way is that we just reassure them that every treatment that we are doing is necessary and specific to their current condition. The other thing that we do is we try and make them as comfortable as possible in our chairs. So we use a lot of topical anesthetic, we have weighted blankets, we do nice collagen hand treatments, we have headphones, earplugs, we have overhead TVs, and then we also have medicinal things that we could use, such as laughing gas or nitrous, but we can also do full sedation if patients need. The important thing is to make people feel as comfortable as possible. That way we can get them the treatment that they need. So I have the privilege of treating this wonderful family that came into my practice, and the husband came in and told me that he had been told by several dentists that he was going to lose his teeth at some point in his life. We took our dental x-rays, we did our exam, and we did our oral microbiome test. And we found that he had significant pathogens in his mouth, and that majority of them were actually resistant to dental cleaning. So not only did we render our periodontal therapy, but we also tested his gut. We got his gut healthy. And then the biggest thing that I tell patients is it doesn't matter if you come and see me every 3 months for your periodontal cleanings. What matters is what you do at home. And so I put my patients on a very strict supplement protocol that includes pro, and post biotics to help rebuild the oral microbiome. That way they can maintain the health. And so when the patient initially came and saw me, we did inflammatory biomarker testing. His markers were through the roof, showing he had a really overactive immune system. He had very deep pockets. His microbiome profile was in really bad shape. And just within 3 months, we were able to gain multiple millimeters of attachment on his teeth. His inflammatory biomarkers returned to nearly normal, and his bacterial profile looked fantastic, all by just doing periodontal treatment, getting his gut healthy, and then putting him on a very strict supplement regimen. We want to make periodontal care and holistic dentistry affordable and available to everyone. So if you don't have insurance, we still welcome you to our practice. We have a membership plan that will save you about 20% on all of our services. And then we also have financing payment options that will help you get the care that you need. So if you are concerned about the health of your gums, please come see us here at Collective Health Society. You can go to our website and book online directly at www.collectivehealthsociety.com, or please give us a call. Our phone number is 303-223-2343.